Physique assessment. The question our expert panel addresses is: what is the best method for assessing body composition? Associate Professor Gary Slater.
The best method for being able to assess body composition may vary depending on the outcome measures you're interested in. For example, if it was a health screening, you really want to be able to get an indication of visceral adipose tissue or that are internal fat. We really need to be able to explore issues such as the reliability, the validity, accessibility and the cost implications of these assessments, because some of the most valuable information really comes from longitudinal monitoring of an individual over time, and the results of which we can then use to be able to further personalise interventions.
Associate Professor Deborah Kerr.
At the moment we don't really have a best method, but for research it's generally recommended that you would use more of the criterion methods such as DEXA or BODPOD, and perhaps a combination of methods to assess body composition. For an individual, it's a slightly different question that we're interested in. They might just want to know how they're changing their body composition over time. So therefore often anthropometry is quite sufficient to be able to monitor that, particularly when it's conducted by someone who knows what they're doing and is accredited and has attended a training course.
Dr. Kagan Ducker.
I think there's lots of different things that you can use. It partly depends on what you have access to using. Sometimes you can use training and use some of the smaller tools of the job. Things like anthropometric tools are cheaper, and if you train yourself up effectively, you can use those quite nicely. At the other end of the scale, there's some quite expensive scientific equipment you can get to assess body composition, and if you have access to that, that's fantastic. But really it's going to come down to what you have access to and knowing the limitations of whatever technique it is that you're choosing to use.
Professor Tim Ackland.
Well, there's actually no best method, but we do support or recommend some methods. This depends on budget, portability, ease of use, etc. And I recommend that readers go and have a look at the position statement and review by the International Olympic Committee, which was published in the British Journal of Sports Medicine in 2012.
For further information on physique assessment, see our book, Best Practice Protocols for Physique Assessment in Sport, published by Springer.